I'm Dr. Mandeep Mehra from Mass General Brigham in Boston, coming live from Dubai at the Middle East Heart Failure Conference. This is the 8th edition of the Middle East Heart Failure Conference, and I'm so delighted to be with two great leaders, Dr. Feras, Professor of Medicine at the Lerner School, and also Chairman of the Middle East Heart Failure Academy and the Heart Academy, in fact, MEHA. It is such a delight to be with you today, Feras. You have been an incredible leader in this field. And I'm also joined here by Milica, Vukićević, who is a rising star in the heart failure world and a Harvey scholar with us here at Mass General Brigham on the Boston campus. So Milica, welcome as well.
Thank you very much.
Feras, I wanted to start with you today and understand what are the specific challenges that you see in the Middle East with heart failure therapies. And to frame this, let me say that for 2 decades we have made such great progress in heart failure therapies. But the biggest challenge that we have worldwide is the fact that we are stunted in our ability to implement all the discoveries that we make in the laboratory or discoveries that we make in clinical trials. They just don't reach patients. And in the lecture that you gave in the welcome opening component of this conference yesterday, I was so struck by the fact that there have been some strides made in Europe, maybe in the United States, in terms of implementation, but that the rates of disease detection and advanced heart failure, for example, in the Middle East are rising. Tell us a little bit about that and tell us what is this implementation gap specific to this geographic region?
Well, first of all, thank you very much, Mandeep, for being with us at the Middle East Heart Failure Conference. You've been a regular contributor to the conference and a huge element in the success of the educational mission in the field of heart failure across the entire region. In my opinion, having come from a US training background and transitioned to the region, there are unique regional challenges when it comes to the advancement of the heart failure and transplant field. And whenever you bring this up, people always think of the resources because they think of the Middle East as either an area with very high resources or an area with very poor resources, depending on which part of the Middle East they're referring to. And as you know, it's a huge region. I always refer to the Middle East actually as the Eastern Mediterranean region because it's an area that extends from Morocco all the way to Pakistan, which is by population the size of the US and Europe combined. And so these areas can have resources, but can also lack resources. So in the areas that have resources, the lack of multidisciplinary heart failure programs is probably based on the lack of interest in building them, or the lack of planning to have them, or the lack of awareness that they're very important to fight heart failure as the upcoming epidemic in cardiovascular disease. In the areas that lack resources, the easiest explanation is that there are no resources to build such programs. So in my opinion, the ultimate denominator is the lack of multidisciplinary heart failure and transplant programs. But why we don't have enough multidisciplinary programs is dependent on which part we're referring to. It could be the lack of qualified people or the lack of resources to build such programs depending on the place. And we need to do a lot of work to create such programs and hence these educational efforts.
Yeah, 750 million people from Morocco to Pakistan, right? Huge population. And what you've said is that resources and lack of a multidisciplinary approach appears to be the key. Resources are a factor based on economies of scale, governmental intent. They're based on structures of education that are available locally. We see a lot of colleagues coming from the Middle East now to train in the United States or in Europe and then go back. You're a classic example of that yourself. And it is the heightened educational components that do that. And now we have a situation where there are universities and medical schools that have set themselves up in the Middle East itself. And so obviously this component of the resource is being tackled on a reasonable scale. Yet I see that there are literally 1,000 people here at this wonderful conference that you have so masterfully commandeered for 8 years and will continue to do for many more. How do you see this bringing harmony to the group? And do you really think that this breaks into the implementation gap that exists in our field? How do you think bringing people from all these different diverse communities with different resource structures, different multidisciplinary teams, how do you see that actually making an impact? Is it just 3 days of education, or is it then 3 days of education with 365 days of implementation followed by re-education every year as you are doing?
Absolutely. It's the continuum of education and networking that takes place throughout the year after such events. When we go through an event like this, we aim at creating networks among not just physicians, but also nurses, pharmacists, dietitians, physical therapists, administrators, and everybody who could play a role in these kinds of multidisciplinary teams with the goal of exchanging expertise and learning from success stories. So these stories could be replicated in areas where these programs do not exist. And again, everything could be tailored to the amount of resources that a region has. Because while we talk about advanced multidisciplinary heart failure and transplant programs that can offer everything from medications to heart transplant, we talk to people with less resources about having good heart failure clinics, which need significantly less resources, but yet can impact outcomes significantly, because the idea at the end is to actually prevent people from getting to the advanced stage of heart failure. So what I learned is that just doing abstract education that is monotonous and classic is not going to change the outcome of heart failure in our region. What I learned is that you really need to tailor this education and address people's needs based on their resources and their backgrounds, and trying to kind of meet all needs within these educational events. So they could be small workshops, but they could be large conferences like this that gather people from all over. And in between, you have to kind of look at the area you're trying to help and really customize your education to meet the needs of them.
Yeah, I think it's really well said, because I think the most important point that I heard you make is the multidisciplinary nature of the attendees. So if you're trying to establish multidisciplinary teams in a region, you can't do so without educating all components of the team. And I think you have to do it through practicums, as you have done so successfully in this meeting. Very well said indeed, Feras. I'm so delighted to hear that. Let me now turn to our colleague Milica. Milica, you are a Harvey scholar with us here at the Brigham and Women's Hospital. In the last year, you have done so much to teach us about Eastern Europe and the challenges of heart failure within Eastern Europe. There are such challenges that I have learned that you have excellent ability to care for patients. I turned out, Feras, to be a patient in Belgrade at the European Society of Cardiology heart failure meeting. I fell down the stairs and broke my arm. And I experienced the healthcare system, and it was wonderful. Now, of course, it was a little bit wonderful because my colleague here commandeered my way through the system. But what I learned was that the system is at the very highest levels. And yet, the uptake of the ability to move technology to the patients with, say, advanced heart failure therapies, heart transplants, LVADs, is quite low. What do you see as the unique challenges in your region, Milica? And I'm trying to understand what is it that is required from your perspective to really make change?
Well, first of all, thank you very much for this beautiful introduction, and I would like to thank Feras very much for organizing this amazing meeting,
Thank
really.
you.
Well, when talking about Eastern Europe and Serbia, I think the most important thing on which we should work on is actually public awareness, first of all, and public trust. When talking about public awareness, especially about patients in the field of heart failure, advanced heart failure, people should know that everyone can be in that position. Healthy people think that they don't have trouble at the moment, they don't have health issues at the moment, and that's it. They're not thinking that it might happen to them also. So it's very important to make people aware that things might happen to everyone and that everyone might be in a position to need actually some kind of advanced heart failure therapies. Second, also very extremely important thing is public trust. We need to build it. I'm also trying to do my best and to implement good things in my own environment, giving good examples from foreign countries. For example, first of all, I got the opportunity to be educated in Vienna at AKH hospital with Professor Andreas Zuckerman. And I've been educated in this field, first of all, there. Then I continued at Harvard, Brigham and Women's Hospital, and started amazing collaboration with you, Professor Mehra. And there is one paper that we published recently together with colleagues from Kazakhstan that actually showed us how it's possible with goodwill to make huge changes in their own environment that can be also implemented in any other environment. The most important thing is to be aware of all aspects of it. First of all, we need to have leaders, well-educated leaders that will actually work on it very hard and try to improve the whole healthcare system, especially in the field of heart failure. Second thing, we should implement good things. Our network and collaboration with people from abroad is extremely important because we can see all the lacks and also good things in their own experiences and implement what we can in our own environment. So it was really an honor to publish this publication with Kazakhstan because already they have their program for 15 years and they gave really good example how it's possible to improve healthcare system in the field of heart failure, to establish a lot of heart failure centers, excellent centers, especially in the field of advanced heart failure, and to build that public trust. All, of course, with the great support of government, yeah.
So that's a great point. So whereas Feras concentrated on education and multidisciplinary teams, you brought up a important point of raising the public conscience, right? You need to build public trust, and that is what drives a government to action. Because if the public doesn't rise, then no one will act on it. And so you need both aspects. You need the resources from the manpower and the multidisciplinary approach, but you also need public conscience to be raised and to raise the country's entire conscience, right?
I actually think the education spans
Yeah.
the public, the policymakers,
Exactly, equally.
and even patients and families just as much as it should span physicians and members of the healthcare.
Yeah, and I think that's a very important point that you made, Milica. The Kazakhstan model is quite interesting because what they did is they started with a problem. The problem was that the WHO mortality data suggested that things were really, really bad from a cardiovascular standpoint in Kazakhstan. So the government was alerted. Then the second thing that happened is that they realized that much of the problem was in heart failure. So what they did was they started with raising the national pride with advanced heart failure programs. They built LVAD units, they built heart transplant. And then over 5, 6, 7 years, they found they couldn't scale them up. And then they realized that the problem was that the inception point of implementation and recognition of the disease was lacking. And they built a system of 300 heart failure clinics across the country. And they built these 300 clinics where they had champions doing something as simple as getting an EKG, checking NT-proBNP, and an echo. And all of a sudden, they tripled the number of patients detected with heart failure within a short span of a couple of years. They increased the use of GDMT to greater than 80%. And then they did something even better. What they did, Feras, is that they launched a real-time national registry database that linked all of these together with the national pride centers that were doing transplants and VADs. And the advanced heart failure patients were quickly and timely referred. For example, in the US and everywhere, we are seeing patients too late who are referred. Yeah. And there is a major gap in the diffusion of technology. And this is how they dealt with it. And I think these sort of local solutions are important, but you have to identify the problem first. And then you have to increase the conscience of the personnel who are going to deal with the problem. And then you have to deal with the public conscience and raise the awareness. So very well said. But Milica, I have to come back to you for a moment here, because I think that the question is, how do you raise the public conscience and how do you raise the awareness? And in today's day and age, the attention spans are really tiny, tiny, tiny. People just are like Twitter character attention spans, Facebook, maybe LinkedIn professionally. And so the question becomes, what is the use of social media in achieving all of these things? Would you make a quick comment about that?
Well, yes, thank you for that very important question. Well, the benefit is there for both, for doctors, for nurses, for everyone in the field of medicine, but also for the patients, just in another directions. In a way that when we talk about symptoms that patients should actually look for and when should they come to the doctor, we need to talk in a language that they can understand. And the power of social media is extremely big. So I'm also working on that in my own environment, talking a lot about symptoms that patients should be aware of when they should think about heart failure. Also, the second very important thing is for our colleagues to be aware of all the phenotypes of heart failure in a timely diagnosis of these patients, because it can save time, it can save also money for the treatment of that patients, and it's extremely important to give a good health care to the patients with heart failure. Especially when talking about advanced heart failure, it's extremely important to have good network all over the country between all the levels of healthcare system, so we can actually recognize it on time and refer patients to advanced heart failure units.
Yeah, very well said. Well, you know, as I've been listening to you both, what strikes me is that at the end of the day, it comes down to leaders. You're a leader, Feras. You're an emerging leader, Milica. I may be a little bit of a leader in my own way. And the question is...
You're a mentor to the leaders.
Well, yeah. Well, thank you for saying that. It's an honor and a privilege to be able to do that. And coming back to that, let me ask you, Feras, the biggest gap I see is we're not creating leaders. How do you create leaders? What is the next step? Maybe you have given some thought to it, Feras.
I've given it a lot of thought, and as you know very well, not only that, I acted on it, yes. and that action was also driven by your advice to some extent. But you know, if I were to summarize what we discussed so far, we're talking about creating successful programs and networking them following, for example, this Kazakhstan model. Yeah. Amazing work based on the description that we just heard from you, that not just needed resources, but needed good planning and good leadership. Yes. And that's exactly the link that you're just adding at the end here. We can discuss resources, we can discuss the planning and what we need, but then it's the leadership. And I realized over time that leadership in medicine is not just by being in medicine long enough. Leadership in medicine is also not just by being a businessman who doesn't understand.
It's not genetic either.
Medicine, and it's not genetic either. So while leadership characteristics are sometimes present in some people, there is also an educational component to it. And I think the two need to go hand in hand. You really need to have leadership qualities to be a leader, but you also need the education to be a leader. And after experiencing the executive MBA program in Oxford for 2 years, I was humbled because when I went there and intentionally did not go through a healthcare leadership program, but rather a business leadership program, I learned that we spend our lives learning about medicine, but we don't actually learn anything about leadership or operations or strategy or anything of that sort. So we need to educate people to become leaders, and we need to kind of replicate these kinds of programs in our region, create these kinds of leadership courses or opportunities. Some of them do actually exist here in UAE, and I'm very proud to see that happen in some of the universities. But I don't think many physicians are actually taking the time or putting the effort to go through them. Yes. And I think the next generation of leaders in medicine will have to have the medicine knowledge, but also the business or leadership knowledge that will allow them to create these programs and tackle these systematic issues like heart failure or diabetes and its complications. And again, it takes me back to the rising numbers of these patients that will burden the healthcare system over time, simply because as the region developed over time, especially here in the Gulf, especially here in UAE, we're now seeing the impact or the result of the lack of preventive care 50 years ago or 25 years ago as advanced disease at this stage. So unless we put together these successful programs that combine the clinical and the administrative skills together and tackle these problems, we will not halt the progression of these big issues.
Yeah, it's very well said. So let me summarize for everyone what I've heard today, because this is really important. We can talk about great successes in clinical trials. We can talk about new drug deliveries and invocation of new molecules. We can talk about new devices. We can talk about AI. We can talk about gene editing, and we can talk about xenotransplantation. But all that is just glamour. The reality is that we are not taking these successes to the bedside and to the patients. And what I've heard from you, so successfully having done this in the Middle East here with this conference in its 8th iteration, is to bring multidisciplinary teams and network and bring them together. And Milica, what I've heard from you is that it's equally important to build the public conscience and public trust. And what we've discussed together is that we have to identify the problem. We have to use policymakers at a governmental level to actually weigh in and deal with these issues. And we have to implement this as a large strategy, as a policy-based strategy. Individuals alone in small communities are not going to solve the problem. We have to do it larger. And the only way to do that is to create new leaders in the field. So what I'm hoping for, Feras, when I come next year, is that you have launched an actual healthcare leadership course on top of this most wonderful educational dissemination course, and we want to create the leaders of tomorrow. Signing off from Heart Failure Minutes. Until next time, I'm Mandeep Mehra from Mass General Brigham.